Hello, this is Dr. Robert Shortell from the Cromwell Chiropractic Center. I just put this brief video together to talk about three main topics: children and chiropractic, upper body conditions, and lower body conditions. When I deal with children, the main three problems I deal with are posture problems, scoliosis, and ear infections. The first one here is posture problems. So on the top left screen, you can see a young woman at a desk. Children are sitting longer and longer periods of time at school and at home doing work on laptops and even watching their computer with things such as Netflix or YouTube on a laptop in bed. On the bottom left, by far one of the biggest injuring things when it comes to posture is the cell phone. As you can see, this young girl is rounded forward with her chin down and flexed. On the right, you see children on a couch looking at their iPads, their phones, and their laptops. This is a common scene that we see nowadays. Children more and more are less physically active, less involved in sports, playing outside less, so their bodies are getting weaker, which also causes postural problems. The first thing here is when we talk about the cell phone. In the center picture is a normal x-ray of the neck from the side. On the left side, you can see the jaw. On the right side, you can see the back of the neck. On the top, you can see the bottom of the skull, and on the bottom, you can see the shoulders. Now, when you look at the x-ray of the neck, there's 7 independent bones. Now, these bones naturally should form a C-shape. And what that C-shaped curve does, it helps to distribute the weight of the head through all 7 bones of the neck. On the right side, you see a common x-ray of something we call text neck. So here, the x-ray shows a reverse curve of the neck. And what this does is this goes to put more and more pressure on specific joints in the neck. Now, here's a picture of that text neck on the left. Now, if somebody has an upper neck problem, because I like to say there's 7 bones in the neck, when they have an upper neck problem, these are the nerves that refer into the head, typically causing headaches. Also, people will notice sinus problems and migraines. When it's in the middle part of the neck at C3, 4, C4, 5, they will have generalized central neck pain. Also, they tend to have problems with their jaw and ears in the form of ringing in the ears and chronic ear pressure or ear infections. When it's in the lower neck, these are the nerves that can drift down into your arms and hands, but more importantly, right into the base of the shoulder blades. So a lot of times people here will notice problems when they're trying to sleep. It's like the pillow isn't comfortable. The second is scoliosis. The image on the left is a normal spine, as if we're looking at someone from behind. So if we're looking at somebody from behind, all the bones of the spine should be straight. So what is scoliosis? It's a bending of the spine to the side. And here we can see in the lower back where there's 5 bones, it bends to the left. And then in the mid back where your ribs are, it compensates and bends back to the right and tends to deform the ribs. Here's a sample x-ray of the lower back from somebody that's had scoliosis for probably 20, 30 years. The x-ray is somebody from behind, so you can see on the bottom, the hip or the pelvis on the left. The right pelvis is on the right. You can see the tailbone on the bottom, and you can see these 5 bones. And you can see on the inside of the curve, you can see these spikes or spurs. That's arthritic spur formation because over a period of time, there's too much pressure on the bones and joints on the left side. So they start to degenerate. And when they degenerate, they form these arthritic changes. So here's a simple home test that you could use for your children and grandchildren. The first thing is you want to look at them from behind. So ideally, if you could have them just in shorts, the top of the shoulders should be level. As you go down, you could see where the arms, there's a space between the arms and the waist. That should be an equal space, and the belt line should be level. When you look at them from their side, their ears should line up directly over their shoulders. Their shoulders should line up directly over where their hip joint is, and their hip joint should line up directly over the side of their ankle. So one of the things you can do is when you're looking at them from the side, you can ask them to bend forward. What you should see is a straight leg, so no bend in the knees. And then as they bend forward, it should be a flat spine. In this example here, this child most likely either has too much of a curve in the lower back or too much of a curve in the mid back, and it forms this rounding or humping as they bend forward. Most of the time, you will not see this when they're standing, but you will see it when they bend forward, and they'll see it especially when they sit down. They tend to round forward. The image on the right is also a nice, easy test. So you ask them just to kind of put all their body parts against the wall So they should easily be able to touch the back of their head, the back of their shoulder blades, and the back of their buttocks against the wall when they're standing. The last is the most common one, which you see often in school. With them in shorts, you just ask them to bend forward, and their rib cage should be about the same or similar height from one side to another. What you'll see in scoliosis, because the spine bends to the side, you'll start to see the ribs elevate or hump on one side. This one on the right side is a pretty drastic example. So when you look at it, you have to be very close. So if you're dealing with like a 6 or 8-year-old child, you'll see a little bit of a rise, but it won't be as deformed as this, because one of the problems with scoliosis is you can see a scoliosis increase 5, 10, 15 degrees in as short as 6 months. So the earlier you spot it, the earlier you can fix it. The last one is ear infections. So there's approximately 30 million visits to pediatricians for ear infections in the United States each year, making it the #1 reason why children go to see a pediatrician. Over 80% of children will have at least one ear infection by the age of 3. Research states that the majority of these ear infections are not due to an actual infection, such as a bacterial or viral agent. The majority of them are just due to pressure or a buildup of pressure in the middle ear. This is a sample drawing of the ear canal. As you can see the ear all the way to the left, and then you have your auditory canal, which is where you find wax and these type of things. So at the end of that canal, you have what's called your eardrum. That's the very start of the middle ear. So the middle ear goes to the eardrum, and then you can see these 2 little organs on the right side. One deals with balance, one deals with hearing. And so there's an opening there. And that opening is where you can build up pressure. The reason why is that middle ear also is in the same contact with the roof of your mouth, as you can see on the bottom right, called your nasal pharynx. Most people notice this as if they're flying up in a plane and you start to feel pressure in your ear. If you kind of plug your nose and build up a little pressure, it will pop that artificially. So naturally the body should do that, but sometimes children have trouble equalizing that pressure. One of the reasons why? There's 7 bones, like I said, in the neck. Now, the upper 3 nerves or upper 3 bones of the neck go to innervate the ear at multiple different joints. So on the diagram on the right side, you see a normal spine. So these are 4 independent bones that line up correctly. If one of them happens to get out of position, what we would call subluxation, it will put pressure on that nerve. Now, if that nerve happens to go to the ear canal, or the nerves that go to the eustachian tube, which helps to equalize pressure between the middle ear and the roof of your mouth, it will cause ear pressure and therefore ear pain. The second condition people are asking me about are upper body conditions. So when we're looking at it here, what I mean by upper body is the shoulder, the elbow, and the wrist and hand. When you're looking at the shoulder, it has 3 main joints. Number 1 is where the collarbone or clavicle connects with your sternum. That's called your SE joint. When people have problems here, they'll mention pain when they're laying in bed, especially. When you look at the second joint here, what's called your AC or acromioclavicular joint, this is when your wing bone or what's called your scapula articulates with your clavicle or collarbone. A lot of times people with pain or problems here, they'll notice pain when they're trying to bring their arm across their body, like across their chest, or if they're trying to lift their arm to the side, especially above shoulder height. The third one is where your arm bone connects to your scapula here, called your glenohumeral joint. So number 3, this is where you'll oftentimes find people who have problems with the rotator cuff problems. So they'll say that after using their shoulder at the gym or outside, it just feels sore and achy, and they oftentimes have to ice it. So as a chiropractor, we can adjust all 3 joints here and recommend specific exercises to improve this condition. Number 2, as we go down, is the elbow. So there's 2 main conditions that we encounter. The first is tennis elbow, which is where number 1 is. That means pain on the outside of the elbow. The second is number 2, and that's more golfer's elbow. Golfer's elbow is more pain in the inside of the elbow joint. So as you can see with the elbow, you have your arm bone called your humerus, and then you have 2 independent forearm bones called your radius and ulna. So if we can improve the alignment of those 3 bones together, it helps these conditions a great deal. The last is your wrist and hand. So this is like we're looking at your right hand as if it's facing down. So when you look at the wrist, it has 8 independent bones. So one of the big conditions that gets that that's caused when people have problems with their wrist is something called carpal tunnel syndrome. So as a chiropractor, we can adjust all the wrist bones. Now, when we look at the thumb and the other four fingers, the main condition I help with is something called osteoarthritis. So when people type for long periods of time, when I deal with tradespeople such as masons, electricians, carpenters, everybody gets their, jams of fingers, they would say. So we can adjust the fingers to help improve the alignment and mobility that brings people great relief. The last topic is lower body conditions. So we're looking at a diagram of the hip. So if we look at, there's three joints. Number one is what's called your sacroiliac joint. Number two is called your iliofemoral joint. And number three is called your pubic joint. So when people have problems at joint number one, which is where your tailbone meets into your hip, people will talk about pain during transition movements. When they sit for long periods of time and then they go to get up, turning in bed, standing in the kitchen at the counter, doing dishes or cooking, even vacuuming will cause pain at this joint. Pain at joint number two, which is your iliofemoral joint. Usually people will notice this when they stand for long periods of time or walk. The easiest way to find out is when they go to put on their shoes or socks, a lot of times they'll have to lift their cuff of their pants to pull that leg across. The last one, number three, this mainly affects ladies, especially after childbirth, because when the baby gets birthed through the canal, sometimes this can push this joint out of position, and it creates this central pubic pain that they've had since they're children. So as a chiropractic, we adjust all three of these joints to bring great relief. As we go down, this is the knee. So number one is the thigh bone, and number two and three are the two shin bones. When you deal with the knee, there's not really a hard joint where they connect. It's mainly taken care of by ligaments. So ligaments are tissues that connect one bone to another bone. But as a chiropractor, you can adjust where that thigh bone meets into that big shin bone. You can also adjust number two, where that small shin bone comes into contact with the other shin bone. But as we keep going down, now we deal with the ankle and the feet. So if you can imagine where the leg bone meets into the ankle, it's almost analogous to the wrist. There's multiple joints there that can affect how the ankle performs. And when people say they sprain their ankle, this is what we're talking about. But we also adjust the foot bones as well. The main three conditions I deal with when it comes to the feet are a flat foot or loss of the arch. Number two on the bottom left are people with bunions. What that means is where the big toe inserts into the central part of the foot, due to arthritic changes, it gets this bump on the inside. And a lot of times I'll see people who have a bunion on one foot, but the other one looks perfectly straight. On the right side, when people start to have feet alignment problems and mobility, it will affect their balance. And a lot of times people will notice they can stand on one side much better than the other side. So as a chiropractor, we help these feet problems by gently adjusting the feet and ankle to bring improved mobility and alignment. Also, we can make custom orthotics for people who need them. And these are custom soft orthotics that you can move from shoe to shoe to shoe. So in summary, on the top left side, we can adjust the spine for people with postural problems, people with scoliosis. On the bottom left, we can help those people with their text neck, people who've gotten injured in car accidents. On the top right, we can help upper extremity problems. So we can help people with shoulder problems, elbow problems, wrist and hand problems. And then lastly, on the bottom right, we can help people with hip problems, knee problems, ankle and foot problems. Thank you so much for taking time out to watch this video. If you have any further questions in the future, feel free to reach out to me. Have a terrific day.